Perpetual focuses its assessment on organisations rather than the projects that are being applied for. We believe that quality organisations understand where their resources are most required to have an impact on the communities they serve. The team at Perpetual are not experts in the areas in which you operate. We therefore do not assess on the project which has been submitted. We ask our clients to be open to support a wide range of projects. These include funding proven programs, pilot programs, core operational costs, infrastructure, and capacity building of the not-for-profit organisation. There are 4 key themes that we look at around strategy, leadership, capability, and outcomes. We're looking for organisations that are well-governed, outcomes-focused, and understand the communities they serve. I will now run through the 7 critical questions we examine in the assessment process. The first 2 are looking at the efficiency of your organisation. 1.8, list between 3 and 5 key performance indicators, KPIs, that your organisation uses to measure the efficient use of its resources. And 1.9, demonstrate how your organisation is performing against the key performance indicators listed above. Efficiency is related to an organisation's ability to demonstrate how they are striving towards a sustainable business model and being efficient with its resources to maximise benefit to the community. Efficiency KPIs are commonly measured by comparing inputs and the outputs used to achieve them. For example, staff turnover rates, a reduction in the cost of program delivery, number of complaints, OH&S incidents, or occupancy rates, etc. Medical and health examples include number of clients treated monthly, response times maintain or exceed industry standard, weighted research publications per FTE academic staff, or cost of direct care against budgeted cost. We are not assessing you on what your KPIs are, but that you have them in place and are tracking them. The KPIs should also include targets or benchmarks to demonstrate how you are achieving them. For example, maintain staff retention rate at 75%. A reasonable performance measure for this KPI would be staff retention rate of 90% achieved in 2018. Other examples are use of volunteers to staff ratio, use of donated goods as a ratio to goods utilised, creation of strategic alliances to present exhibitions, particularly for arts organisations and museums, growth of fundraising income versus cost of fundraising, or unit cost of program delivery. I want to give you some examples of responses that have ranked well. Now, traditionally, we haven't done this because we don't want a replication of examples that were given. We want you to sit down with your boards and reflect on what your efficiency measures particularly are. An example is around human resources, such as staff engagement. Quality staff engagement means that you're probably able to keep your staff for longer and ultimately reduce the cost of recruitment for your organisation and provide continuity of personnel. Another example might be very specific, related to the cost of the unit of delivery of whatever your program is. So it's really important to reflect on how you know you're optimising your use of resources. What I really want to flag for you here is we're not assessing whether or not we like your efficiency measures or what we think should be your efficiency measures. We understand that you're only being asked to provide a selection of them, so we're not assessing whether or not they're conclusive either. Essentially, what we're assessing is whether your board understands how it's utilising its resources and how it's tracked against its KPIs. The second 2 assessable questions are looking at the effectiveness of your organisation. 1.10, list between 3 and 5 key performance indicators, KPIs, that your organisation uses to measure effective achievement of your mission. 1.11, demonstrate how your organisation is performing against the key performance indicators listed above. This response should relate specifically back to your organisation's mission and strategy and how your board or leadership team measures how effective your organisation is at achieving its strategic priorities. Can you show how you are tracking year on year within your organisation? Effectiveness measurements will vary from organisation. There are many ways to measure effectiveness. Here are a few examples. Organisations' membership numbers used to measure community awareness. Student retention rate and job creation numbers indicate social impact of programs. Arts organisations can measure through visitor numbers or ticket sales, which is community awareness. SROI analysis is fine. Securing NHMRC funding and growth in published research papers is an indication of quality research projects. This is for research institutes. Achieving accreditation, example, Australian Council of Healthcare Standards, indicates maintaining operating level. International loans from art museums in the arts promotes access to the arts. Organisations may utilise publicly available data collected by other agencies as evidence of effectiveness. For example, if the mission is to improve the health of the Murray River, an organisation may cite data collected by catchment authorities. When responding to 1.10, again, we're looking for metrics, ratios and figures relating to how you're tracking against your identified KPIs. Ensure you include measurable targets. Again, you don't have to be positively tracking. You may actually be tracking in a negative way, and this doesn't matter to us. What's important is that you're aware of your KPIs and you're tracking them. Here are some examples of measures that scored well in our assessment process last year. It might be around expansion of programs into new areas or with new partners that will help deepen stakeholder engagement. It could be around client satisfaction or retention of stakeholders. You'll see again, we're not assessing content, but process. We fundamentally believe that an organisation that understands whether it's going really well or really poorly against its own KPIs is an organisation that understands it may need to pivot on occasion, to make adjustments to be effective and to be efficient across different programs. Take care not to confuse the terms efficiency versus effectiveness. In simple terms, efficiency relates to productivity with little or no waste. Effectiveness relates to goal attainment. Being effective is doing the right things. Being efficient is doing things right. The next question relates to external forces. 1.12. Provide 3 to 5 external forces or trends that are presenting challenges to your organisation. Please list them first, then provide further detail in the box below. Note that we have modified this question and the next question, 1.13, which relates to internal risks. We now require you to provide a list of key challenges or risks in the first section, which is a high-level summary, and provide more detail in the section below. This question relates to an organisation's awareness of the external environment, including public policy, government, other organisations working within the sector and the community. Are there political issues that could impact policy? Has there been legislative change? Has your operating environment changed? Some examples. If you're working in the disability sector, the NDIS may be a major external factor facing your organisation. A rise in unemployment and increase in living expenses could put pressure on your social programs. The ageing population could be putting pressure on your services. Challenges of operation in a digital world, or housing affordability affecting homelessness. This is an opportunity for organisations to demonstrate that they are aware of external forces, current and future, that may impact their operations. What we don't want to see is general funding or the competitiveness of funding being one of these external factors, as these are generic issues affecting the sector as a whole. What we really want to get a sense of is whether your organisation understands the systemic issues specific to you. The next question relates to internal risks. 1.13. Provide 3 to 5 risks that affect your organisation. Please list them first, then provide mitigation strategies and additional detail in the box below. Again, this question has been modified. We now require you to list the risks in the first section, which is a high-level summary, and provide more detail in the section below. Risk is an important factor when looking at an organisation's governance. So we ask this question to understand how your organisation mitigates against internal risk and has strategies in place to manage these risks should they eventuate. Please ensure you provide a risk and how your organisation is mitigating and managing this risk. The purpose of your organisation will influence the risks that may affect you, but there are common categories which can be considered. Financial could be fraud or under-insurance. Strategic fails to identify external threats or opportunities. Legal and regulatory, failure to comply with relevant laws and regulations, for example, OH&S, work cover, or privacy laws. Operational, disruption to services due to system failure. Or brand and reputation, third-party association or partnership. People, key person risk if your CEO is also your CFO and also your key fundraiser. As I mentioned, these are common categories of risk management. Your organisation may have more or less than these. And finally, question 2.8 is the only question that relates to the project or activity. 2.8, what are your expected outcomes of your proposed activity? State how you will measure these outcomes. This is the only assessed question that relates directly to the activity or project that you're seeking funding for. We assess on the 2 parts of this question. 1, what are your expected outcomes? And 2, how are you going to measure these? We're looking for evidence of realistic, measurable and achievable goals and outcomes, including their impact on society. This should be outcomes, not outputs. An outcome is something that can be shown to have happened as a consequence of producing an output. Outputs are what organisations do, for example, direct deliverables. Outcomes are the difference or social impact of the results of an organisation's outputs. A program's outputs can and should influence an outcome, but cannot guarantee the outcome will occur. For example, if the funding is going to be used to conduct an activity to improve the health of asthma sufferers through the distribution of information brochures on asthma management, the number of brochures distributed is the output. This itself is not evidence of the outcome. The outcome is measured by whether the health of the asthma sufferers has improved. The second part of the question is assessing that you have considered measurement from the start of the project. We are not assessing your methodology, just that you have identified how and what you will measure. Measurements help an organisation to understand the extent to which it is achieving its outcomes and are also useful for informing program development, i.e. can help an organisation understand whether it needs to make changes to the way it delivers a program or service.